remember when I started working here, you had a plan for our mutual friend.
Right. For the lawn company.
Uh-huh.
And they had come to me a couple years prior and were trying to offer a benefit of some sort, because they were a small business, to their dental, or to their patients, my patients now, right, to their staff, and they didn't have options because they were trying to get insurance. It was too expensive.
Yeah, those plans are so expensive for small businesses. So you had this annual plan that you had, I don't know, 10 or 15 people on, but it wasn't really promoted.
No, and it was great. It benefited the patients or the workers, and the workers appreciated it from their
It was a
employer.
benefit.
But we never really marketed it until you came in, and then
Well, and then all these patients started asking me for guidance on what plans, what insurance plans to buy, because it was right around the time the Affordable Care Act was implemented, and there were a lot of changes with employers and with benefits all around. And the last thing we wanted to do was, tell them to spend money on a plan that we knew wasn't going to be, in the best interest for them.
right, and these membership plans, we controlled it, so we
Yeah.
knew what it was going to cost, and the patient knew what it was going to cost, and we were able to develop it. And with your help, you kept telling me, man, it's hard to sell a $300 a year or $400 a year plan. Why don't we make it monthly?
Well, people, when you think of benefits, it just is a monthly payment.
Right.
And especially for families, people budget on
Right.
a monthly basis.
Right.
Whether or not you're on a limited income or not, it really wasn't an income-based thing. We have the one patient that they own a private plane.
Right.
They're on the membership plan just because everybody wants a deal.
Right.
And so
And
it
you
just
created
grew.
the monster for me, is what you did.
Right. We created this monster, and
Then you left to go
passed
be
it
a mom,
over.
and now I got to find another staff, and they come in and go, I got to run how many credit cards every month? And I'm like, yeah, I'm sorry. So it got to a point where we weren't
Right.
able to manage it.
Right.
So I called you up, and your kid was what? One, two, something like that. And I said, hey, that plan that you started, that membership thing, not the membership, but the monthly membership, and you started a couple years ago, now it's unmanageable. So find me a software
Yeah.
that we can run this plan. So you went out there and you looked, right?
That was really the start of our market research, and there were a couple different options, but they fell short.
Right.
in a lot of areas, and they didn't really. We just wanted a platform to run our plan.
Right.
We wanted it to be our plan.
Right, and we want it to be our plan, not only from the transparency, or we'll say from our dental office. When I say that, when we talk to the patient, we're like, hey, this is our plan. It's not some other company's plan. It's not
a third party.
Not a third party. It's our plan. It's a relationship. We're building a relationship and trust between the patient and our office. And we couldn't find that software that would allow us, or a company that would allow us to do that. So I said, let's build it.
Right.
And that's what we did.
So we did.
And you took it upon yourself, and we built this software, and it's been phenomenal. It continues to grow. It continues to evolve. We're seeing benefits that we never thought we'd see.
Patients are choosing these plans by and large over the other options out there just because there's just frustration with insurance for good reason.
Right.
These dental insurance options that are out there just are not comprehensive. They leave patients and the staff frustrated. It handcuffs the dentist. You're trying to obviously work within the confines of these plans, and it's frustrating for everyone.
Right, and it's hard, and some offices have taken the approach to say, well, I'm just not going to participate in any plans, and I'm just going to go my own way. That's fantastic, and you know what? Those practices are awesome for memberships, because now you're not worried about the limitations, but what you're doing is you are capturing those patients, and you're actually doing them a favor by saying, hey, come in, here's your membership, come in, and you come here 2 times a year, 3 times a year, whatever, and it allows. The word transparency comes back all the time in my mind, and our patients love it.
And there's no limit on the savings. So
No.
if they have a big treatment plan, especially in this office, they have a big treatment plan, that courtesy or, that those discounted rates are for whatever they need.
Right.
So you're not capped at a certain point. And they have the peace of mind to know that they can come in, they can bring their families in, they can get everything they need every 6 months, and if they do happen to need, because that's the other thing, consumers, we don't want to pay more for something we might not need. So with these plans, you're paying for exactly what you need.
Right.
And anything more,
Yeah.
you're gonna save money.
Right, and then in offices too, you can develop your plan however you want. I personally feel that the preventative care is where I want to make sure, because I want to remove that hurdle, because we all know the more often you go to the doctor or the dentist, the less likely you are to have a big event happen.
Right.
So by people coming in and helping them make that affordable so they continue to come in, that's great. But we've seen things, people have developed plans all over the place, like they've added an emergency visit and a PA that helps release that apprehension. We've seen people give a credit on their accounts, which I think is a great option.
Right, like a loyalty.
Like
you
a
know,
loyalty
You're
thing,
on
yeah.
it for a year, you get, a credit on your account toward
Yeah.
treatment.
So it allows the dentist and the office staff to really help patients
Yeah, and reward
and
them.
reward them to
For that.
create that loyalty and a personal relationship without having some other entity dictating how things are going to go, or influencing, not even dictating, just influencing how we practice.
Yep, absolutely. It's a total win-win.